Hello everyone. Today's topic is fat soluble vitamin A, D, E and K. I will discuss all of these topics in details. The part 1 of this video also shared in this channel. If you have not seen it, please go to my channel and watch this video first. If today's video is helpful to you, please like, comment and share this video with your friend and subscribe my channel. So let's start. First of all, vitamins. What is vitamins? Vitamins are tasteless organic compound required in the diet in small amount to perform specific biological function for normal maintenance of the health and growth. So vitamins are a tasteless compound that is required in our diet in small amount and it perform a specific biological function for normal maintenance of optimum growth and health. It is the most essential component for our body, but it do not provide energy themselves. So vitamins are the compound that is required for our health and growth, but it do not provide energy. Then classification of vitamin. Vitamin can be classified into two types: fat soluble vitamin and water soluble vitamin. Fat soluble vitamin includes vitamin A, D, E and K, and water soluble vitamin include vitamin B complex and C. Then coming to the next slide, the history of vitamins. The vitamin is a Greek word where vita means vital for life. The term vitamin was coined by scientist Casimir Funk in 912, when he trying to isolate fat-soluble factor V, he discovered a substance containing nitrogen, which is chemically called amine, and was therefore named vitamin, where vita means life and amine is a nitrogenous compound. Fat soluble vitamin. There are some important points about fat soluble vitamin. First, vitamin A, D, E and K are the fat soluble vitamin. They are stored in the body for a long period of time. Vitamin A, D, E and K, as they are fat soluble vitamin, so they are soluble in fat but insoluble in water. But their excessive intake can be toxic, so they can create toxicity in our body. After intake and digest of the fat soluble vitamin, in small intestine, fat soluble vitamins are transported into the intestinal cell and packaged with fat and other lipid into chylomicron. Then this chylomicron travels through the lymphatic system to our main circulation. So after you intake vitamin, especially fat soluble vitamin, it digests and it reach in the small intestine. There the fat soluble vitamin are transported to the intestinal cell and then the packaged with the fats and other lipids and form into a chylomicron. Then this chylomicron is travels through the lymphatic system to our main circulation and then stored in liver and adipose tissue and our body used as their requirements. Then the excretion normally occurs after transformation during metabolism. It's stored in kidney, liver, muscle, brain and fatty tissue. Observed by small intestine and excreted through the fecus via the bile. The first topic of fat soluble vitamin is vitamin A. Discovered. The activity of vitamin A was discovered by scientist Christine Strombuk in 1919. Later, McCallum and Davis found fat soluble factor in vitamin A in 1915 and then Holman isolated it in 1917 from fish liver oil. Then the next point is form of vitamin. It has three forms. First one is retinol, an alcohol form. Second, retinal, an aldehyde form. And third, retinoic acid, a carboxylic acid form. And in the structure of retinol, you can see that there is the alcohol group CH2OH, that is the alcohol group of retinol. In retinol, you can see that there is a aldehyde groups present in the structure C double bonded OH. And in retinoic acid, you can see there is a carboxylic group COOH present in the structure of retinoic acid. Then coming to the next slide, the daily requirements of vitamin A. In case of adult man and woman, there is a 600 microgram of vitamin A is required. And in pregnant and lactation period of women, there is 950 microgram of vitamin A is required per day. In case of infant, there is 350 microgram and in children is 600 microgram of vitamin A is required per day. Then the source of vitamin. Animal sources are fish liver oil like codfish, milk and egg yolk. Plant sources are carrot, green leafy vegetable, orange color fruit like mango, apricot. Functions of vitamin A. First point. Vitamin A is a colorless vitamin that creates an important role in vision. Vitamin A is essential for maintaining the function of rod and cone cells and helps in the vision. Point 2. It prevents night blindness. Point 3. Maintain epithelial cell of skin and hair growth. 4. Important for growth and development. 5. Promote bone development. Point 6. Beta carotene, which is a precursor of vitamin A, act as an antioxidant. 7. Essential for immune system. Deficiency of vitamin A. First, night blindness is also called nyctalopia, where the ability to see in dim light is completely lost. Point 2. Keratomalacia. Cornea in our eyes becomes softened and then finally it destroyed. Point 3. Xerophthalmia is also called dryness of the eye. Point 4. Bitter spot. You can see in this picture there is a small dot in cornea. Point 4. Cornification of skin and mucous membrane. Cornification means the dryness and hardness of the skin. Point 6. Infertility. It also affects on the maturation of ova and embryo mortality. Diagnosis. How can you diagnose the deficiency of vitamin A? Mainly there are used electroretinography method and a serum retinal blood test is done in the lab. Then the last point is treatment. Oral supplement usually take for the treatment. 2 lakh AU of oral supplement usually take on to successive day. The second vitamin of fat soluble vitamin are vitamin D that was discovered by Edward Mellenby in 1919. Then the forms of vitamin. It has two forms. First one is calciferol or ergocalciferol is also called vitamin D that is found in plants and dietary supplements. And the second form is cholecalciferol that is also known as vitamin D3 and it is especially found in skin and animal foods. In the side of this slide there is a D2 and D3 structure. You can practice this structure and also write in this in your exam. Then the dietary requirements of vitamin D. In case of infants, it is 400 IU per day. In case of children, it is 600 IU per day. In case of adults, it is 600 IU per day. And pregnant women, it also 600 IU per day. So the dietary requirements of vitamin D is also same in case of children, adults and as well as pregnant women. Later, the source of vitamin D. The important source of vitamin D is sunlight. In the presence of sunlight, UV ray first converted to 7 dehydrocholesterol and then it converted to D3. That is also known as cholecalciferol, that is active form of vitamin D. Other sources are whole milk, liver oils, sun-dried green vegetables or fruits, fatty fish like salmon or mackerel fish, and egg yolk. Function of vitamin D. First one, regulates calcium and phosphate absorption and metabolism. 2. Control blood pressure. 3. Increase mineralization of bone. 4. Promote germ cell production. 5. Increase immunity of the body. 6. Reduce the risk of the cancer. And point 7. Regulation of gene expression. Deficiency of vitamin D. In the deficiency of vitamin D, it promotes the demineralization of bones, rickets in children and osteomalacia in adults. Osteomalacia is the softening of the bones and it also affects in the growth of the human body because it helps in the formation of bones. So in case of the deficiency of the vitamin D, it also affects the growth of the human being. Then the diagnosis of the vitamin D. First of all, physical examination. Some patients' medical history and the appearance of the patient can be checked in the physical examination. Other tests like 25-hydroxy vitamin D or calcidiol blood test and 1,2-dihydroxy vitamin D or calciterol test. And bone density scan. Other tests may include serum calcium levels or the serum alkaline phosphate levels. Treatment. Doctor usually suggests to take lot of food supplement. Then natural sunlight exposure. Vitamin D is also called sunshine vitamin because the UV ray of the sunlight helps to make vitamin D. Third point, in the initial stage, patient must need 6000 IU daily or 50,000 IU weekly for the 8 week in the initial supplement. In the vitamin D deficiency in adult, they are 10,000 IU daily until vitamin D level increase 30 mg per ml. In case of vitamin D deficiency in children, they are 2000 IU daily until the vitamin D level increase 30 mg per ml. The third and most common fat-soluble vitamin is vitamin D. It was discovered by Evans or Bishop in 1922 in oatgum oil. Then the form of vitamin. It has 8 different form of vitamin, but the alpha tocopherol is the most active biological form of the vitamin E. The source of vitamin E are nuts like almond, seeds, vegetable oil, milk, meat and eggs. Later, the function of vitamin E. First point, vitamin E act as a membrane antioxidant. Second, it play an essential role in neurological functions and it also inhibits the platelet aggregation. Fourth point, it protects the liver from being damaged by toxic components such as carbon tetrachloride. It also supports our immunity and reproduction. Deficiency of vitamin E. In the deficiency of vitamin E, it may causes hemolytic anemia or megaloblastic anemia, erythrocyte hemolysis, and it also creates some neurological problem. It mainly affects on the central nervous system. The others problem like muscle weakness, weak immune response, cystic fibrosis and liver disease. It may also occurs due to the deficiency of vitamin E. Diagnosis, physical examination and blood test include measure alpha tocopherol level is done in the laboratory. The daily requirements of vitamin E in case of adults it may be 12 to 15 mg per day and in case of children it may be 6 to 11 mg per day. Treatment. Doctor usually refers to take lot of vitamin E supplement like nuts, seeds, vegetable oils and leafy green vegetables are added to regular meal that are the high source of vitamin E. In the deficiency of vitamin A, children must need 3 to 7 mg per day vitamin E supplement and in case of adult 10 to 15 mg per day vitamin E supplement. The last and most important fat soluble vitamin are vitamin K that was discovered by Henrik Dam in 1929. Forms of vitamin. There are two major forms of the vitamin. Vitamin K1 is also known as phyloquinone and vitamin K2 is also known as menaquinone. And another important vitamin K3 is also known as menadione. Vitamin K1 or phyloquinone, it is mainly found in plants. K2 or menaquinone, it is mainly found in animals. And K3 or menadione, it is present in the synthetic forms. In the side of the slide, there is a structure of vitamin K1, K2 and K3. You can practice it and also draw in your exam. Daily requirements of vitamin K are, in case of adult man and woman, it is 70 to 140 mg per day and in case of children, it is 35 to 75 mg per day. Then the source of vitamin K are leafy greens, cheese, liver, egg yolk, fermented foods, bacteria in intestine like lactobacillus. The function of vitamin K. The main function of vitamin K is blood clotting. So it also called anti-hemorrhagic vitamins. It also helps to prevent prostate cancer, bone metabolism, osteocalcin activation that also helps in bone metabolism. And vitamin K also helps the synthesis of the clotting factor. Clotting factor are synthesized in the liver as an inactive precursor. Vitamin K converts them to active forms. Deficiency of vitamin K. In the deficiency of vitamin K, it prolonged bleeding time and poor bone development is also called osteoporosis and it also increases the chances of cardiovascular disease. Diagnosis of vitamin K. In the diagnosis of vitamin K, blood test, PT or prothrombin time test are done in lab. Later, the treatment of vitamin K. In the treatment of vitamin K, patient must need to take vitamin K supplement is also called phytonadione. In the deficiency of vitamin A, in case of men, required 120 microgram per day, and in case of women, require 90 microgram per day vitamin E supplement. So thank you everyone. I discuss fat soluble vitamin in details. If today's session is helpful to you, please like, comment and subscribe my channel, and also share this with your friends. Thank you everyone.